The number of COVID cases in the community has likely doubled since last night, with health officials confirming there are 4 more probable cases linked to the Auckland outbreak. The 4 confirmed cases are from the same South Auckland family. 2 of the probable cases are from a connected household, and 2 are work colleagues of one of the confirmed cases. There was a separate further case reported in managed isolation today. The passenger in question travelled from Islamabad via Doha on August 7. In the past hour, the Director-General of Health has used his special pandemic powers to order significant groups of people to isolate at home until they're spoken to by contact tracing services.
And that direction applies to the following people, if you could listen carefully. Any employees or contractors of 2 employers. One is Americold in the Mount Wellington suburb in Auckland, and the other is the company Finance Now, and that is the Dominion Road branch in Auckland. I would also say that the direction applies to the following, and that is any visitors to those workplaces, in the last 14 days, and any people who ordinarily live with those employees or contractors or visitors.
Dr. Ashley Bloomfield there. It will be mandatory for all businesses in Auckland to display a QR code to allow people to track their movements. It's also been revealed family members who visited Rotorua while displaying COVID symptoms stayed at the Waiora Lakeside Hotel between August 8th and 11th and visited the Skyline Gondola on the 9th and the Heritage Farm and 3D Gallery on the 10th. Now, health officials say there are no close contacts in Rotorua, but people who were also in these places need to be vigilant about their health. Well, joining me now is the Health Minister Chris Hipkins. Good evening, Minister. In terms of the stay-at-home order, how many people do you estimate are affected by that?
There could be a couple of hundred people. So the contact tracing is now well underway for all of them. But we're taking a very, very precautionary approach here. The Director-General wants to make sure that they are isolating, that they are out of circulation, so that if any further of them have picked up COVID-19, that they're not spreading that.
So what checks will be done to make sure that that is the case? They are self-isolating?
Well, look, obviously we have an alert level 3 restriction across Auckland now, so that means that most people will be isolating. But the message really out of all of this is, each household will have a designated person they're sending to the supermarket. If someone falls into that category, they shouldn't be that designated person. We want them to stay home until they have had their tests done, until they have spoken to health officials. That contacting, that calling is happening now.
So when you say there's a group potentially of several hundred people, how long do you think it's going to take to get in touch with them all?
At least 200 calls had been made as of the last update that I got, which was about half an hour ago.
So what? How long is it going to take you to get through them all, Minister? What's the deadline?
They're working around the clock. We've got 160 people in a call centre making phone calls as we speak, so I imagine that will be done very quickly.
OK, what is the modelling telling you about the likely infection rates? Because we know from Professor Sean Hendy, his modelling said, for every person infected that you find in the community who is not directly a border worker, there's likely to be 10 to 15 others. So by his modelling, we're talking to 40 to 60 other infected people. What's your modelling telling you?
Look, at the moment, the modelling could be a smaller number than that, or it could be a greater number than that.
What's the top end that you're looking at here in terms of your modelling?
Well, look, I think we're not focused so much on the modelling as we're focused on the testing and the contact tracing. We're basically going to run this thing to ground. So we're going to find every person who's come into contact with the positive cases. If any of them test positive, we'll find every person that's come into contact with them. And we're moving at speed to do that. So no one's messing around here. Now, the modelling is an interesting academic exercise. Far more important, though, is the testing and contact tracing, because that's actual people rather than hypothetical scenarios.
Understand that, and everybody does appreciate the efforts being made, but obviously you must be working within some parameters. So what's the top end of those?
Look, I don't have a top end. It'll be as many as it is, and we're geared up for that. So we've got contact tracing ability on stream now to be able to contact trace up to 350 positive cases per day. Now, bearing in mind we're dealing with four positive and 4 probable at the moment, so we've got lots of capacity there. We will do as many calls and as many contacts as we need to run this to ground.
So where do you think that this has come from?
At this point, it is a real puzzle, and I think that's one of the reasons that we moved very quickly last night, because it is a real puzzle. The family concerned have no known links at this point that can be identified with people who are working in managed isolation or in quarantine or at the border, or who have had the travel history, recent travel history. So that does make it a particularly, puzzling question, and that's one of the reasons why we are exercising an abundance of caution here, because we don't want to see community transmission take off again, and the faster we go through this exercise of testing and contact tracing to run it to ground, then the less likely that is.
So one of the companies involved is a cool storage and logistics company, right? So what consideration has been given to the virus potentially coming in on goods that potentially have been imported?
So we haven't discounted that as a possibility. The advice that we've had from the scientists is that that's a less likely scenario, but it certainly has not been ruled out as a scenario.
So what information gathering are you doing on those sites to rule that out or in?
So at the moment, there's one cold store site that seems to be the centre of the group at the moment. So site visits have been taking place today, and that will include testing on site.
Okay, you're increasing the number of testing facilities because in Auckland, well, they were overrun today. How many are we expecting to see before the end of the week in terms of testing sites?
Well, in the next 24 hours, so we had further ones being stood up this afternoon. There were additional 6 that are being stood up this afternoon, and there are 3 more that are being stood up at 8 o'clock tomorrow morning, so that's 9 extra testing centres. 2 more, of course, were stood up first thing this morning. So we are doing everything we can to scale up testing as quickly as we can. And, of course, through GP practices, we're asking all GP practices to be able to, to undertake tests for people who need those tests. And that's the long-standing practice there. So we want to make sure that availability of testing is as wide as we can make it. But I guess I do have a word of caution to people. Some people are having to wait. Please be patient. Please do keep waiting and do get that test if you're showing symptoms.
Realistically, Minister, are we really going to be back at level 1 in Auckland by the weekend?
Look, I think we will know a lot more by Friday, Lisa, and that's one of the things, there are so many
But you must have a bit of a feel for it now, because overnight we've gone from 4 cases, 4 confirmed, to an extra 4 probable, and now we've got several hundred people on stay-at-home orders. So can you be clear with us about what you're thinking might happen on Friday?
No, the 4 probable cases at the moment are still closely connected to the 4 positive cases, so it could still be a reasonably tightly controlled group, or it might not be. And so at the moment we can't rule in or out any scenarios, but we will have a bit more of a sense of that in the next 48 hours. We're giving ourselves that time to really get on top of, what do we know about the situation, and then we'll, at the moment it would literally be crystal ball gazing for me to hypothesise what might happen on Friday, or what position we might be in on Friday.
What are Auckland schools being told around expectations for how long students are going to be learning remotely for? Because we're hearing up to 2 weeks, some of them are being told.
Look, at the moment, the guidance to schools is exactly the same it is to everybody else. These restrictions are in place until Friday, at which point, by Friday, we will have further notice about how long any future restrictions might be in place for. And again, at the moment, that's just a purely hypothetical scenario, because we literally just do not have enough information at this point to be able to make an informed decision around that.
Minister, before you go, how many people were tested already so far today in the Auckland area?
I don't have numbers for today. We had about well over 4,000 yesterday, but obviously very, very high numbers today. That'll take a wee while for them to tabulate that information, but we know that we're going to see a very high number of tests today.
And when are you expecting the results back from those workers already tested, those people already tested connected to the infected family?
Up to 10,000 test results will be processed overnight, possibly slightly more than that if they do what's called pooled testing. and obviously the labs are working around the clock to process tests as quickly as they can.
Appreciate your time this evening. That is the Health Minister, Chris Hipkins.